standards, so through which we can make the data interoperable. So integration of the devices sources, so combining data from EHR, diagnostic images, lab results, and patient-reported data. So we can integrate the devices sources. And so what is the challenge? Because data integration is not very easy task, because everyone has technical integration, technical aspect. So inconsistent formats, because every website, every portal, every application, digital health application has their own format, and they are collecting the information in their respective format. So it is not possible, it is easy to take the, exchange the data through the API or something, because the best way of, transferring the data through the integration of the data through the API. But for that, we need a uniform format for that, on the format in the form of data, as well as in the form of technology. Then only you can transfer the data through the API, right? So we have the data silos, because everyone is collecting the data as per their requirement, as per their format. And the legacy system can complicate the integration of data from different sources. Now the problem is that, suppose we want to integrate two different devices together. Okay, so what about the legacy data? So before, like we are doing the integration today only, so what about the data which is available for both the applications, legacy data? Okay, so either it can be go into the archive, or we will integrate it from the legacy. So it's a very difficult, it's not very easy to integrate two devices. Okay, then data governance. Data governance means how we are governing the data, what the regulations are there. You suppose any government or any one has created a data, source data mechanism for the data collection, storage, integration. So these mechanisms should follow a particular mechanism for particular compliance with the regulations. So we should follow the data quality mechanism for that, so that ensures the healthcare data is accurate, complete, and up to date. So because poor data quality can lead to medical errors and ineffective care, because in data science we generally say that garbage in, garbage out. So what the data we are receiving, so accordingly our outputs will be there. So it will not be helpful for effective decision making. So data quality we should maintain. Okay, so then we have a data ownership. It clearly should be mentioned that who owns the data, because this data is related with the patients, sometimes data related with the healthcare providers or insurance. So it is very essential to mention clarify the data ownership. Like, who is the owner of this particular data? Suppose it is related with the patient, so patient will be the owner of data. Suppose some certain information or data is provided by the healthcare providers or insurance. So it is very essential, and it is critical for the ethical and legal reasons also, right? So this data ownership is very important. Then compliance and regulations. In addition to HIPAA, healthcare organizations may need to comply with GDPR, that is General Data Protection Regulations, or any other local laws. Like in India, I have told you, Disha is there. Every country has their own data protection legal acts or guidelines. So your digital health device, who is especially dealing with the data, should follow or should comply that particular guideline. So how you maintain the data quality? So this data quality, for this maintain the data quality, accuracy should be there, ensuring that the data entered is correct and up to date. Completeness, data should include all necessary information to avoid gaps in patient care or research. It should be consistent, that is standardizing the data input, using the same coding for the diagnosis, helps reduce errors. Data governance, that is implementing policies, standards, and procedures for managing data quality, security, and access. Right. So these are the important checkpoints through which you can maintain the quality of your data. Now, the most important part of data management is data analytics, because what the data we are collecting, we are managing, and maintaining the quality and everything. For what? This data is used for the analysis purpose, so that by analyzing that particular health data, we can produce some insights, useful insights for the policy making. Okay, so there are various statistical tools are available. Since I'm a statistician, so I will not go into much detail, because that should be different aspect, that should be different webinar. But this health data can be used for the predictive analytics, because predictive means what the data is available currently. On the basis of that historical data, you can make some prediction for the betterment of the outcomes. Okay, it can be used for the predict the outcomes, such as hospital readmission risk, patient deterioration, or disease outbreaks. So these are for the prediction purpose. This data can be used for the prediction purpose. Then population health management, aggregating and analyzing the patient data to identify health trends and develop the preventive care strategies. So what the data is available to you, you have to use that particular in analysis part whenever you are going for the analysis. So you must ensure that your analysis should be very useful for the future purpose. For the sake of analysis, you will not do any analysis. That analysis part will provide you the insight for the future purpose to improve the health services. So it can be used for the personalized medicine as well, because when you are analyzing the genomic data, clinical data to provide the tailored treatment, because I have told you the customized treatment plan can also be created on an individual's unique profile. AI and machine learning, because currently we are using the artificial intelligence and machine learning tools for automatic data analysis. Whenever we have a huge amount of data and your data is not fulfilling any particular assumption, okay, and you can use the various supervised and supervised and unsupervised machine learning techniques to identify the patterns, recommend the treatment options, and support decision making. So these are sophisticated data analytics tools which are provided by the machine learning techniques, right? Now, data sharing and interoperability, because you have to share the data also with other stakeholders. What the data you have collected, you should be your vision or your mechanism should be very clear for the exchange of that particular information. So health information exchanges facilitate the secure sharing of patient information across different healthcare providers to improve the care coordination. So then we have the patient control data initiative like Blue Buttons allow patients to access and share their own health data with the different providers, because you have the patient is on the central point. Okay, what the data you are collecting, the patient should have the right to see their particular data at any point of time. And you have to set the in data sharing, you have create that mechanism. Then regulatory compliances, I have told you, every country who is practicing the digital health tools or devices, they should have the follow the compliances. Like in USA, we have HIPAA. GDPR in European Union, we provide the guidelines on data protection. FDA regulations. Okay, Indian regulation, like we have DISHA, that is Digital Information Security in Healthcare Act, and in India we are also creating other act for the data protection of patients, right? So this every country they are doing in this direction. So if you are a healthcare provider or if you are any organization who are working on the digital health, so you must be aware about the prevailing data protection bill and or act in your country. So now we come to the challenges in the healthcare data, because health data management is not an easy task, as I have told you in a very simple way in 30 minutes, but to really, implement it in the ground level, there are certain challenges out there. And why I'm talking about the challenges, so that you must aware how these challenges can be overcome. How can you deal with these challenges? So first challenge is data silos. I have told you for a single information, there are so many portals, there are so many applications are there, and they are collecting the same information in silos, right? So data stored in isolated systems can lead to incomplete or fragmented patient records. Then we have data security. Data security is also a challenge because there are so many healthcare data is a prime target for the cyber attacks, because these type of attacks which because this health data has a rich experience, a rich source for the any country's patients, for the markets, for the pharmaceutical companies, for the insurance companies. So this kind of data is useful for them. That's why they always target this kind of data, health data. So the prime object and the prime importance is your data security, data privacy, because there are some ethical issues are also there. You are collecting the information from patients, so privacy, you should maintain the privacy, you should take the consent from the patient. So ethical issues are also there. So balancing the use of data for research and improvement of care with the need to protect the patient privacy. Interoperability. So legacy systems and varying data standards can impede the seamless sharing of the data. Okay, now I'm talking about what are the future trends or advanced technologies which are used, which can be used for the data security, for the data analytics, and the other tools for the data management. So the first and very important tool for the securing the data security is blockchain. This is a very important advanced technology in blockchain. This is an emerging technology for the secure decentralized data management, enabling the better control over data sharing and access. This blockchain mechanism is very important and very emerging and advanced technology for maintaining the data security. Then AI based, this can be AI technology can be used for the data collection, and most importantly in the form of data analytics. These machine learning techniques can provide you the insights by analyzing the data within seconds, right? Real-time data analytics. So wearable and IoT devices will provide the constant stream of patient data, improving the real-time decision-making, genomic and precision medicine. I have told you, so with the help of integration of genomic data with the clinical data, you can find out the information about any particular patient's condition. Accordingly, you can create the tailor-made precision medicine for a group of or targeted group of patients. So with this, now we are coming to the conclusion. Like effective healthcare data management helps to improve the patient outcomes, enhance operational efficiency, and supports compliance with the regulations, making it a critical aspect of modern healthcare system. But on the same time, we should have some challenges like data security, interoperability, and data sharing. So we should follow, and most importantly, ethical issues, because you are taking the information of any individual patient. So you must aware about the ethical practices, guidelines which are prevalent in your country. So thank you with this. Yeah. So I will be happy to take any questions.
Thank you very much indeed, Dr. Yadav. This was very insightful and interesting, and I believe also quite relevant to our audience. As we've seen, a lot of our audience members are, in fact, senior level professionals in the area of healthcare, and I'm sure that this knowledge that you've provided to them on data management and understanding future trends, especially genomic and precision data, will be of extreme relevance to them. So thank you very much for that. Dear participants, please feel free to write any questions that you have in the Q&A section. I see that there's one question by Godlove Moshi. I see also some participants are trying to raise their hands. So do keep in mind that we won't be able to answer your questions if you raise your hand. Just type your questions in the Q&A, please. So I'll read out the question to you, Dr. Yadav. The
Yes,
questions
please.
by Godlove Moshi is, what obstacles are we facing in data management systems, and how can we solve them?
So I have already mentioned that there are certain obstacles are like we have a just give me 1 minute. Yes, so I have told you that there are so many issues for the data management, like ethical issues are there. We have interoperability because currently the data is collected in silos, and for the effective decision policy, decision making policy, because this data is useful only if it provides you some useful insights for the policy making, right? And for the effective policy making, we need integrated data in different aspects, right? Suppose someone is collecting the information about the patients with particular disease, then other agencies collecting the data on expenditure on health. Okay, then third agency is collecting the data about the socio-demographic factor of that particular patient. So for the decision making, this silos kind of data is not very much important, useful. So for that, we need to create an integrated portal which you provide the data on these three aspects simultaneously. Like any patient who is having the particular this socio-demographic group, okay, and suffering from this particular disease, and they have make the expenditure on this much, so that government can have a clear-cut picture on the health outcomes. So this integration is very important. Then
Thank you.
data accuracy and data ethical issues are very important. Yes.
Thank you very much for this answer. We have a question also by Elias Getachew. What is
Yes.
your recommendation for countries who do not have data regulatory compliance?
Okay, so those countries who are not have the data regulatory authorities, they should follow certain data privacy rules or guidelines which are recommended by the WHO or the World United Nations or some other international agencies rather than any particular country, because they all are keeping in mind holistic vision of all the countries. But at the same time, your health department should create a certain kind of guidelines as per your local need.
Thank you. And perhaps the last question for today from Anupam Pandey. How can we ensure data accuracy as well as improve screening for remote areas, including indigenous communities? Are there any follow-up mechanisms in real time designed to monitor such cases?
Okay, so in the remote areas, I will tell you the latest technology like AI, machine learning, and such kind of sophisticated learns are very useful. Okay, in India we have developed so many mechanisms for taking the screening and imaging and other kinds of testing and the follow-up. We are using the AI-based tools, so this can be useful in your country as well.
Fantastic. Thank you very much, Dr. Yadav, for your presentation, but also for your insightful answers. We'll just close as we usually do with a second poll, which would be your feedback about today's session. So you should be able to see the questions in front of your screen. This one's a little bit shorter than the last one, so please do take half a minute or so to provide your feedback. Thank you. So far, we have 20 responses and growing. So at this point, about a third of you, just slightly more than a third of you have responded. We've got 60 answers and growing. I think without any surprise, the feedback is overwhelmingly positive, with 98% of participants having said that this information was useful. So this is indeed credit to Dr. Yadav. Thank you once again for this. 95% of, oh, now it's 96% of participants have indeed expressed interest in exploring data management courses, which are in fact provided by Empower School of Health and UNITAR. 60% of participants are interested in digital health, with the second most popular topic being data management and supply chain and health leadership. And the most popular form of courses are online certificates not exceeding 2 months, with the second most popular one being online diplomas for 6 months. We now have 50% of you have answered, 70 answers in total, and the overall positive feedback remains the same, with 67 out of 70 having said that this information was indeed useful, and 3 having said somewhat with no negative answers, saying that the information was not useful. So on this rather positive note, I want to thank all of you for your time and attendance and excellent questions, and thank Dr. Yadav once again for his insights and expertise on the big.
Thank you for inviting.